Let me greet all of you who made it till now. And let me introduce my topic. Effect of tumor necrosis factor alpha inhibitors on the outcome of major long-term complications in IBD patients. I'm Hajnal Székely, working as a medical doctor at Semmelweis University Department of Surgery, Transplantation and Gastroenterology. As a PhD student, I have Pál Miheller as my supervisor and the excellent Anett Rancz as my SMS. My mission is to extend the knowledge regarding some important clinical factors of IBD, and the mission is to improve the quality of IBD patients' care. Within our project, we plan to investigate the role of the mentioned biologicals on venous thromboembolism and colorectal cancer, respectively. Regarding our first project, we have to mention that the risk of IBD patients of having venous thromboembolic events, it is considered to be 2- or 3-fold increased compared with the general population. The average prevalence, it is considered to be varying between 1% and 9%. If this complication appears, it is considered to be a relevant cause of morbidity. It results in longer hospitalization, has a tendency to recur, and may be also fatal. The mortality rate of these events, it is reported to be varying between 8% and 25%. The majority of these events are going to present clinically in the form of deep vein thrombosis of the lower extremities or pulmonary embolism. Rarely the cerebral, the portomesenteric veins may be affected, or may be a catheter-associated event. Venous thromboembolic events are considered to be always multifactorial. There's a slide missing, sorry. Some of these well-known risks, besides the well-known risk factors, there are some disease-specific characteristics that should be taken into account. Namely, the extensive disease in ulcerative colitis, the colonic localization in Crohn's disease, the fistulizing phenotype, the active disease flare, and the consequent hospitalization. Regarding therapy-related risk factors, the surgical interventions and the usage of corticosteroids have a role in this regard. So, based on these data, regarding other anti-inflammatory drugs used in IBD, the data are relatively scarce. It is well known that tumor necrosis factor alpha inhibitors are considered to be effective in inducing and maintaining remission of IBD, and also to decrease the rates of hospitalization and the need for surgery. If you take into account the fact that tumor necrosis factor alpha, it's a pivotal molecule, not just the inflammatory process, but also may activate the coagulation cascade, we may presume that inhibiting this molecule, we may interfere with the risk of coagulation in these patients' category. So our aim was to compare the effect of these drugs with the other conventional therapy used in IBD patients. So for the clinical question that we formulated, we used the PICO framework, and our hypothesis is that anti-TNF drugs are associated with the decreased odds of venous thromboembolic events compared with the conventional IBD therapy. You see here the summary of our selection process. We had more than 10,000 hits, out of which there were 16 eligible articles for our project. The data analysis basically shows, so we determined by the data analysis and compared at the same time the risk of venous thromboembolic events in the different treatment categories. We were able to include just retrospective cohort and case-controlled studies, as randomized controlled trials are not available within this topic. We would highlight the importance of these events, as again, they increase the morbidity and mortality of IBD patients. We encountered large heterogeneity, most probably due to the fact that the characteristics of IBD patients included is really varying, and also the dosage of the corticosteroids used to achieve clinical remission. As a measure of effect, we choose the odds ratio, where an odds ratio of 1 means that there's no difference between the effect of the interventions. But the summary of our data, when we compared the patients treated with anti-tumor necrosis factor inhibitors and corticosteroids, showed an odds ratio of 0.37 in the favor of tumor necrosis factor alpha inhibitors, meaning that these patients have a decreased risk of venous thromboembolic events compared with those patients treated with corticosteroids. And this effect was proven to mathematically be significant. But to decrease the imprecision of our data, we also determined the proportion of patients having venous thromboembolic events in the mentioned treatment categories, showing again that tumor necrosis factor inhibitor treated patients are less likely to have this complication compared with those on corticosteroid therapy. Basically, following the same methodology, we compared those patients on biologicals and immunomodulators. Here, the combined effect proved to be 0.88 odds ratio. So here, in these two treatment categories, neither the odds ratio, neither the proportion of patients affected did not show any statistical significant difference, meaning that in the clinical practice, regardless of which type of treatment regimen it is used to assure long ongoing remission of the disease, we may encounter similar probability of venous thromboembolic events. So based on these data, we may conclude that there's a possible association between biologicals and decreased risk of venous thromboembolic events in IBD patients, mostly outlined by the fact if when compared with corticosteroid treatment. Besides the fact that we would like to highlight the importance of this rare but severe complication of IBD, we should emphasize the fact that early initiation of anti-TNF drugs, it is useful in the management of those mostly at high risk of venous thromboembolic events. There are many limitations to our project, namely the fact that these were just retrospective observational studies included. There's a heterogeneity of the IBD population. There are many confounders to be taken into account when assessing the venous thromboembolic risk. There's a characteristic of co-medication within this patient population. For these reasons, there's a low certainty of our evidence, but these limitations point toward further research needed in this area, namely prospective, large, well-controlled trials, adjusting for many confounders known within this topic, and probably to assess a causality of drugs in the regard of venous thromboembolic events. Regarding the progress in our first project, we are at the state of manuscript writing. The second complication that we choose to assess in the regard of TNF-alpha inhibitors on the long run is the IBD-associated colorectal cancer. It is also well known that these patients have a 2 to 6 times increased risk of colorectal cancer. These malignancies appear at a younger age and they tend to be multifocal. As an outcome, they may result in 10–15% of patients' death. Here, the IBD is not just the culprit region of the disease by itself, but also is the basis of the carcinogenesis, meaning that here we may, that this disease follows the inflammation, dysplasia, carcinoma sequence. So based on the fact that with proper controlling of the inflammation, we may somehow interfere with this process. Our aim is to assess the effect of tumor necrosis factor alpha inhibitors on IBD-associated colorectal cancer. Seemingly, we used a PICO framework with the hypothesis that these drugs may decrease the odds of IBD-associated colorectal cancer. Regarding this project, we just built the preliminary search key, and we are still looking for articles to include. So in summary, our project aims to determine the possible role of biologicals and two major complications of IBD, namely venous thromboembolism and IBD-associated colorectal cancer. And let me finish with a quote. The scientist is not the person who gives the right answers, he is one who has the right questions. So again, I probably won't know the proper answers, but you are allowed to ask me questions. Thank you.
I would like to ask you, Hajnal, if there were any previous meta-analysis on this topic, on the first one and on the second one?
On the first one, obviously, it was conducted by Patricia Sarlos at Pécs in 2018, aiming to not directly compare the effect of certain drugs, but to elucidate their effect regarding venous thromboembolic events. So I know this meta-analysis, we are aware of this. Regarding the second project, it was one conducted in 2021, published in the American Journal of Gastroenterology. It is a detailed one, takes into account many confounders regarding the development of colorectal IBD-associated colorectal cancer. But regarding the TNF drugs, those data are relatively imprecise.
Actually, this meta-analysis was my first one, my favorite one. For the second project, I would like to ask you, why not looking for other biologicals? There are many of them, ustekinumab, vedolizumab, and so on. It would be more interesting, maybe.
We did not find enough and appropriate data in this regard. Obviously, it's going to be important on the long run or later on to check this topic also. But taking a look at the literature, there's not enough data yet.
But as far as I can remember, your Székely would have covered those studies as well, wouldn't it?
No, it was just the anti-TNF drugs.